So the call has been made by organizations already previously established in the simulation world for a certificate, and then with long-term conversations leading towards standardization, and certification of those positions. And what I put to the group, as well as Dr. Baron did as the introduction to the speech, our dean from the School of Medicine, was that an organization capable of speaking for these things would be best done by the people who are actually doing the work and the job of the position. So I'm a firm believer that the techs will know the tech job the best, because it's the position and the experience that they bring to the table that allows them to have and share what would be the best practices with regards to that position. And is experience right now connected with salary ranges? If you were to manage people or have a paramedic's license, are you rewarded for having that additional background and experience? And if the techs are not the ones to put together these types of programs, then who are going to be the people that do that? And are they really going to have the best perspective on what the requirements of this position are going to be? And a second critical question is, are you responsible for recommending technology purchases? And I'd say a good 65% of the room raised their hands to answer that question, indicating yes, that they are. And so I think that's an important shift in the industry at this point. Kind of like a flower budding for the first time, we're getting to see internal parts of an industry that's still developing for the first time as it's being exposed to the elements. And I think one of the things that's going to continue to grow as simulation technology becomes more global and modernized and spread out amongst all of the continents is the understanding and the need for a technical profession to help support with this process, because it is something that is a different skill set from the primary goal of the educator to begin with. And so all of this led us to get to a point where simulation technicians might find the opportunity to come together and start their own organization that supports them with both the training and then the support necessary to educate others about why it's important to have a simulation technician and what they're capable of doing, as well as deal with things like certificates, standards, and certification, provide annual meetings and trainings, and then resource blogs, kind of like the ones that we shared here. I pointed out to the technicians in the group during that day that most of us remember having 386 computers when we were younger, and we've just entered into an age where Watson can win Jeopardy hands down. And so technology itself and simulation technology is not going anywhere. It's going to continue to expand, and it's going to continue to develop and grow. And so as a group, it would be time to start considering that there would be a need for a support institution or organization that will help directly with what they were working on. And by the end of the meeting, we had an overwhelming request to not only continue the Gathering of Technicians event annually, but also start an organization that can help to ensure that the communication and best practices are being shared and developed over a long period of time. And so that's what kind of why I started sharing about my background is that altogether everyone is going to be entering into a new space where we are the first ones to land at Plymouth and take a look around us and see where we're at as regards to a body and a group of people who have similar backgrounds, come from different avenues, and are engaging in, for the first time, a new career field that revolves around healthcare and technology. And so, much like myself with getting my start producing yogurt at one point, while that might not be a best practice that I can share with others, I can definitely share with them about my best audio-video practices between making films and other things. And so everyone, when they come together, is going to have an ability to learn and share in a way that's really going to grow and shape our industry from years to come. Just to run through a couple of the quick other survey results that came out of the pre-meeting survey. Are you responsible for setup and tear down of task trainers or other low fidelity skills trainers in the labs? Overwhelming, the response was yes, 64 people out of the 85. What is your experience with mannequin moulage or makeup? Most of the group was over 50 people, so about 60% were saying they had none or were novice, while some said that they had moderate experience with that. So about 33, about a third of the group said that they had moderate experience, but it's definitely some opportunities there to continue to train and to grow. Do you implement simulations as the voice of the patient? Sometimes we are all trading off depending on gender or availability, so that was definitely happening for the most part. Others responded here, yes. Over 20 folks said that yes, they are the voice of the patient, but have received little to no training to do so. So between these two numbers, I think that is one of the primary responsibilities of a simulation technician or specialist is to help with acting out the voice of the patient. If you do implement simulations, do you ever play a support character, a confederate actually going into the room and taking on a role? No, about 25 said that they do not. Yes, they play various non-professional roles such as a family or friend, and then yet another third said yes, and I do play professional roles. Only about 8 people said that they do not run simulations, and so we're relevant to this topic. How many simulation labs are you expected to run at the same time if each lab has at least one high-fidelity mannequin running? 1 to 2 was the primary bulk of what the responsibilities were, and then it dropped off from there. But some people having to run 5 or more. And so that's something that we're going to have to analyze and look at is what's going to be able to help people who only can run 1 or are responsible for running 1, and what is the minimum number expected out of staff? What should be the number that they can realistically run in any healthcare simulation lab? And would you be interested in enrolling in a certificate training program for simulation technicians? And the answer was overwhelmingly yes, that they would. So I hope you enjoyed this presentation. It was a small recap of what I kind of shared with the group and what everyone was getting ready for on Friday of last week, August 5th. We then engaged in about 2 days of training, everything from moulage to hardware programming and software, 2 different sessions with the 3 different vendors. Folks could select which vendor that they wanted to work with. We also had an audio-video production class to help people with orientations for the simulation labs, as well as promotional videos for the simulation labs. And then we had a conversation from John Cordova, who gave that presentation about medical moulage, as well as Jane and Christy about empowering technicians. Suzanne Sharp, our simulation coordinator, gave a presentation about the first year of our chaotic first year of simulation at the CSC, as we were combining 3 schools into 1 new space with 6 new staff members, and what it took to get the program operational. And Jonathan, our IT simulation technician, was the one to run that audio-video production class. And lastly, Bobby America gave from moulageconcepts.com gave a great presentation about moulage. So it was a really interesting first meeting, and we definitely are looking forward to continuing with this process, both in terms of the development of an organization and annual meeting to support technicians as this industry continues to develop. So thanks so much from the Clinical Simulation Center of Las Vegas and healthysimulation.com.